Nobody wants to be lonely, and when I was using, heroin was my best friend.
I had a total hip and 7 surgeries prior to that, and they started prescribing me narcotics when I was 13.
The guy that I met in high school, he started stealing his grandfather's pain pills. I'd started using drugs with him. I'd found out I was pregnant.
I used for half of my pregnancy.
They say that addiction is one of the only things that can kind of override the maternal instinct. That is completely true.
Opioid use in America, whether prescription misuse or illegal drugs such as heroin, has become an epidemic. West Virginia is one of the hardest hit communities for substance use disorders, with nearly 1 in 5 babies born with evidence consistent with inappropriate drug use before birth.
Babies that are born addicted are very sad. They cry, they're inconsolable, they act as if they're in constant pain.
They will experience symptoms that are very similar to what adults experience when they're going through withdrawal.
It's one thing for me to go through withdrawals, but I never wanted my kid to go through withdrawal.
I can only imagine what that does to such a small body.
You watch your baby go through what you know is an in-body hell.
Aetna Better Health, in collaboration with our contracted providers and community organizations, is making a positive difference. The Neonatal Abstinence program is one initiative that is delivering promising results, along with healthier babies.
When you identify a mother who is using, we try to enroll her in the case management program. We get her into treatment if need be. We follow her throughout her pregnancy. And then once the baby's born, we enroll the baby in the program as well.
Our people make the difference. Case managers work with women one-to-one to create paths to sobriety and having a healthy baby.
She was kind, she was non-judgmental, and she was very open and willing to help me.
She's got a lot of resources, and she's really helped with my recovery.
We kind of act as a social worker as well if they need help with resources in the community.
Some of them don't have transportation to get to their appointments, so I'll set the transportation up.
She was like an actual person who actually cared, and that was a huge difference.
A lot of people that I've dealt with are homeless, so I have to help them try to find housing.
You can tell they have hearts. They actually want to help drug-addicted mothers.
Babies born with substance issues need specialized care in the most appropriate setting. Lily's Place provides specialized care for these newborns.
Our practice here at Lily's Place is just to simply take care of babies who have been exposed to drugs while mom was pregnant. The vast majority of these babies who require medication to assist their withdrawal, they end up in the neonatal intensive care unit. We're actually trying to take those babies out of the neonatal intensive care unit, put them in other locations where they can frankly get a little more therapeutic care and environment, still getting medication and still treating their withdrawal.
The Neonatal Abstinence program that I went through was great. We had a great counselor that worked with us.
They cover all bases, things that you would deal with just having a normal child, and then the extra stuff you have to go through with having an NAS baby.
If we weren't there to help them to get into treatment programs, to get them off of the street drugs, to get them clean, these babies would just fall into the system, bouncing from home to home, possibly fall into addiction themselves.
I am a 17-year drug addict, and you know, it worked for me.
There are a lot of addicted mothers out there that don't know what to do, and they don't have anybody to turn to.
Success would be having a full-term, healthy baby who thrives, just a normal baby.
Success is to be able to take care of themselves, to take care of their children, to be able to keep a roof over their head, hold a job, and maintain their lifestyle as a sober individual.
Stayed clean, got a job, went back to school.
The most helpful thing is that I'm able to stay clean. I work, I'm able to lead a normal lifestyle.
It was the greatest decision I ever made, was to get clean.
It gave me my life back. It gave me my mind back. There's no better feeling in the world.
Aetna Better Health. You don't join us, we join you.